Dr. Oughton, I want to ask, first of all, how you feel as a healthcare worker about Quebec's decision to allow some infected people to remain working.
Certainly, it's a sign of the that we, the healthcare system, are in right now. That, as you very correctly pointed out, how many healthcare workers are currently off the job, on home isolation or on home quarantine, and how difficult it is to keep the system running, especially when the healthcare system is under such pressure from Omicron right now. I have to say myself, as a healthcare worker, I certainly didn't sign up with the idea that I would be potentially working while sick and thus posing a potential risk of transmitting infection to my patients. And that's exactly the job that I have to do, is the opposite of trying to keep them from getting infected or treat them while they're already sick. So it's certainly a difficult change to wrap one's head around.
And what about the risk to you personally? I suspect that for privacy reasons, you won't know which of your colleagues may in fact be infected, right?
That is correct. I think a lot of the Quebec plan is really going to hinge on the details, which are still to come out. There's so many protocols here to be thinking about. For example, healthcare workers who were exposed but not yet symptomatic and therefore still working. What's going to happen if they develop symptoms in the middle of a shift? Is there a way in which both they can leave the shift halfway through while services are still somehow being provided to the patients that were under that healthcare worker's care? And is there going to be some way of making sure that healthcare worker who's then developing symptoms can get prompt and reasonable care? How is that healthcare worker who's infected going to all the logistics, where they're going to have a change room, where they're going to have a lunchroom, where they're going to have a bathroom that you're going to have to somehow separate from the non-infected healthcare workers? There's a lot of things that are going to need to be spelled out, I think, in great detail in the few days that are to come.
Oh, that's a real insight into what is going through the minds of healthcare workers in Quebec right now with this news. On top of doing your job, yesterday the Quebec Health Minister says in the coming days they expect 10,000 healthcare workers will be off the job for COVID. What are you seeing yourself at work in terms of staff shortages and the impact? And do you agree that this is really the only choice right now, this kind of a measure?
This isn't the only choice, but we're really left, as sometimes happens in different aspects of clinical medicine, we're left with a list of potentially bad choices. You either have healthcare workers who are exposed, infected and recovering, you put them back on the job, or you reduce the amount of services that are available, which, like I mentioned earlier, in the middle of a surge of disease, this fueled by Omicron, that would mean turning away patients, whether it's because of they're seeking care for more severe symptoms from Omicron, or all the other things that always happen in the middle of, despite the fact that we're in the middle of a pandemic, heart attacks and strokes and trauma and so forth. Where are you going to put those people if you don't have the healthcare workers? So there really are no good choices, and I really do wish that provinces and public health authorities that are looking at these kinds of measures make sure the public understand that this is not something that we go into lightly, nor does this come without its own particular set of risks.
Are you worried about anxiety from patients who now will know that they may be treated by someone who has COVID-19?
That's an excellent question. I think there's, in fact, I think it goes both ways. I think that certainly patients come to a hospital or healthcare center looking to get better. They're not looking to get exposed to another infection. We've certainly seen already healthcare-associated outbreaks of COVID-19 at many points during this pandemic. At the same time, honestly, as a healthcare worker, I think many healthcare workers are going to be very worried about passing the disease on to their patients, onto their colleagues. And I suspect that this is another aspect of this plan that really needs to be worked out. How are you going to deal with that anxiety? Is there going to be some support for the potential issues that are going to arise, not only on the day of that job, but in the days and weeks afterwards? Because that's going to change a bit the usual dynamic, I think, between healthcare workers and patients, and probably not for the better.
Just in summary of listening to all of your answers and hearing the myriad of questions and concerns you have, do you think this is a bad idea?
Like I said, I don't think there is a good option here. And I do, however, really think that the effectiveness of this and the safety of this is going to hinge on the literally thousands of details that are going to have to be spelled out. And this is, as the minister very correctly pointed out yesterday, this is a situation that is staring us right in the face. We don't have a long time to iron out these thousands of details. So unfortunately, Quebec is not for the first time in this pandemic, going to be a bit of a test case that, as you pointed out, I think a lot of other provinces, a lot of other jurisdictions are going to be watching very closely. And I would be surprised if every single last detail gets done perfectly on the first go-through.
I want to ask you about another measure that we are hearing about that some provinces may also be considering, and that is, as we know, rapid tests are key to eliminating isolation in asymptomatic people and shortening that time. As you know, the CDC in the U.S. is recommending cutting isolation for patients without symptoms who are positive, cutting it in half to 5 days. Do you think that is another measure that will have to be looked at in Canada to address the staff shortages we've been talking about?
I think it is really born out of the same fundamental problem. When you have something as infectious as Omicron that can cause such a huge rise in infections in a very short period of time, you have to have some way of keeping keeping society functioning. And again, although the CDC says that this is based on evolving evidence, there's really not a lot of evidence, especially when it comes to Omicron, to say that this is absolutely safe. This has a degree of safety to it, but are there going to be people who are still potentially infectious after 5 days? That's certainly what we've seen with other variants of Omicron before, and I would not be surprised if that continues to be the case here. So is this something that may have to be looked at as a way of keeping not just healthcare industry, but society and industries in general functioning? Unfortunately, it is. But again, this needs to be done in a structured way. And your previous interview there, I think it was Dr. Gupta, talking about testing your way out. That's at least a sensible way of using some objective data rather than just relying on the subjective presence or absence of symptoms to help guide us.